We're going to begin first to 5 of the developing story. Kaleida healthcare workers, represented by 2 unions, have delivered a 10-day notice now of an informational picket.
And it comes following months of failed contract negotiations. Big concerns include better pay and staffing shortages. Thanks for joining us tonight at 5. I'm Mary Alice Demler.
And hello, everyone. I'm Scott Levin. Tonight we are hearing from Kaleida on what their plan is if the workers walk off their jobs. 2 on your side's Liz Lewin joins us live from Buffalo General with what's at stake here. Liz?
Well, Scott and Mary Alice, that picketing is expected to start in just 10 days outside of Buffalo General and Oshai Children's Hospital. 2 of those major concerns you just mentioned have to do with competitive pay and staffing issues those union workers say have yet to be addressed. Now, if all of this sounds familiar, that's because just last fall, union workers in the Catholic health system over at Mercy Hospital did the same thing for many of the same reasons. That strike, if you recall, went on much longer than both parties expected before an agreement was actually reached. Now, as for Kaleida, those new contract negotiations started back in March, and we're told in an effort to reach an agreement as quickly as possible, union workers and hospital executives had been meeting 5 days a week at this point. A spokesperson for the hospital system tells me negotiations are still, quote, cordial and productive, and that a lot can happen in 10 days. Avoiding a strike, he says, at all cost is their #1 goal, as is finding a way to meet an agreement similar to Catholic Health's.
At this point, right now, really comes down to economics. We've exchanged economic proposals. Their initial proposal would be about 8 times what we spent for the contract in 2019. That's just, that's cost prohibitive. So our goal is to get back to be the market lead and to be the employer of choice.
Well, Hugh says if a strike does happen, Kaleida has been working on a contingency plan for the past few weeks, so they will be prepared to meet patients' needs temporarily until agreement can be reached. But again, the hope is that this plan won't be necessary. I will remind you that here in New York State, they have required hospital systems like Kaleida to create these clinical staffing committees, all in hopes of being able to actually avoid things like picketing and strikes. So far, Kaleida says they have invested $90 million into more jobs, 436 new jobs to be exact, and those are expected to come over the course of the next 3 years. Here in Buffalo, Liz Lewin, Channel 2 News.